Well, thank you very much for inviting me to speak here today, Excellencies, ladies and gentlemen. I was asked to speak about the humanitarian situation in Syria, specifically in northwest Syria. And I think I'll have an opportunity to speak about early recovery and livelihoods later, which is more in line with the themes of this conference. I also just wanted to echo what the former speaker, His Excellency, the former Minister of Malaysia, was saying about the importance of local partners and localization. I've been into northwest Syria now more than 25 times since the earthquake, and I've been hugely impressed by the professionalism and the commitment of the local partners that I have met during these missions. And I have to say that the Syria Cross-Border Humanitarian Fund, which is managed by OCHA on my behalf and which distributed more than $140 million last year, more than 2/3 of that went to local organizations. So, ladies and gentlemen, after 13 years of conflict, the humanitarian situation in northwest Syria is at its worst. Humanitarian needs have increased in numbers and severity. In 2024, 4.2 million people in northwest Syria, or 82% of the population, are in need of humanitarian assistance to meet their most basic needs. The majority are women and children. Syria remains one of the world's largest displacement crises. More than 7 million people are internally displaced in the country, and nearly half of them are in the northwest, many of whom are living in camps and informal settlements in appalling conditions. So we've got 2 million people in northwest Syria living in informal settlements, 800,000 in tents, with limited or no access to healthcare, clean water, or other basic services. 87,000 camp residents live with at least one form of disability, and 75% of camp residents are women and children. As I said, amidst an onslaught of crises and disasters, communities in northwest Syria, so the communities themselves, have demonstrated incredible resilience. But the prolonged impact of a 13-year conflict, compounded by last year's earthquakes, are pushing people to the brink of survival. Syria remains what we call a protection crisis in 2024. Active hostilities continue to affect civilians and civilian objects, with women and children reported amongst the casualties in northwest Syria. And in 2024, more than 80% of the population in northwest Syria require protection assistance, including access to legal services, case management, mine action activities, and tailored psychosocial support. Last October saw the largest escalation of hostilities in northwest Syria in 4 years, resulting in the temporary displacement of more than 120,000 people in 2 weeks. At least 100 people were killed. Nearly 40% were children, and more than 440 others were injured in the first 3 months of the escalation. More than 40 health facilities, 24 schools, and 20 water systems in Idlib and northern Aleppo were affected. And I myself visited the displaced in the immediate aftermath of this escalation in October. And I spoke to the people living in collective centers. And of course they have immediate material needs, but what they want above all is safety and security to enable them to relive their lives. I've visited hospitals on the front line in places like Ariha and Benesh, and I've witnessed the incredible bravery of the doctors and nurses who continue to perform life-saving operations underground, a special facility built underground in these hospitals in the midst of shelling. I'd also like to echo what the former Malaysia Foreign Minister was saying, His Excellency, about children and the importance that children are for our future. And one of the worst aspects of this conflict is the impact on the children. A whole generation of Syrian children are deprived of education, protection, and a sense of normalcy. Children make up almost half of the population in northwest Syria, with many having grown up without even knowing peace. Over 1 million children do not go to school in northwest Syria, an increase of 200,000 out-of-school children following the earthquakes. Idlib has the highest out-of-school rate among all governorates in Syria in 2024, with 69% of children missing out on education. And the longer children remain out of school, the less likely they are ever to return. Access to education is particularly dire in the camps, where 58% of camps and displacement sites do not have schools or learning centres. Almost all camps lack a secondary school. And out-of-school adolescents are particularly at risk of child labour and child marriage. So, as I've just described, the needs have gone up, but unfortunately, the funding has gone down. So the humanitarian response plan for the whole of Syria is requesting just over $4 billion for 2024, which is actually a 15% reduction on what was requested last year. As of today, it is 8% funded, and this simply is not good enough. I cannot stress enough that there is a significant human cost to the reduction of humanitarian assistance with a rippling impact across all sectors. So this year, 3.6 million people in northwest Syria, so 70% of the population, do not have enough to eat, which is an increase of 300,000 food insecure people since the start of 2023. But amidst the increasing food security, food assistance has only decreased. So with the available funding, partners could target 600,000 severely food insecure people to prevent them falling into starvation. But this means that 3 million people who are moderately food insecure are not getting any kind of food support. Partners have also reported that funding for resilience-based activities in agriculture and food production has also reduced or stopped. Displacement camps are witnessing an increasing suspension of humanitarian support. The provision of water, sanitation, and hygiene services, including clean drinking water, was suspended in 188 camps in Idlib due to funding shortfalls at the end of last year. And what this does is exposes people and more than 100,000 camp residents to the increased risk of cholera and other diseases. And this will only worsen as we approach summer with the increasing demand for water, because diseases spread more easily in the warmer conditions. And maybe just to say that we know that if funding to support the health sector is not received by the end of June, 160 health facilities, including 46 hospitals, will be forced to suspend their operations. Finally, I wanted to talk quickly about humanitarian access. So the cross-border humanitarian operation from southern Turkey into northwest Syria is a lifeline in enabling us to support the United Nations and its partners to support the most vulnerable people. But up to this point, we're experiencing the lowest number of trucks crossing the border in the history of the response. Less than 200 until this point. If you compare that with last year, 1,700 trucks crossed the border during the same period last year, 2,100 in 2022, 3,700 in 2021. So, the cross-border operation isn't just about trucks. The UN and its partners also provide health support and other critical services. And also, I think our physical presence provides protection support. But it's an important symbol. And we need to try to correct this. And we're seeking funding for that. I mean, the UN and its partners, the UN is crossing almost daily into northwest Syria. And, in average, it's about 30 cross-border missions every month. So this enables us better to monitor projects, which is very important as part of our overall risk management strategy, to assess needs, but most importantly, to engage with field partners and the communities themselves to strengthen coordination and bring the response closer to the communities that we're trying to serve. So finally, as I said before, the overarching message is that the needs are going up, the funding is going down, and we need to try to address this. The EU is hosting a ministerial conference in Brussels on Monday. I will be going to that conference, and in the run-up to that conference, we're trying to give more advocacy and communicate with the media to ensure that they are fully understanding of the gravity of the crisis in Syria, particularly northwest Syria, and the massive funding gap that we now face. So those of you here today who are from member states, I hope you have clearly heard my message. We desperately need your support. The people of Syria desperately need your support. We fully understand that there are demands elsewhere, of course, Gaza, Sudan, other contexts, and it's a global economic crisis, should we say, or it's tight. But please do not let Syria become a forgotten crisis. Thank you very much. Thank you. Shukran. I think with the lack of funds, it's affecting humanitarian programs, but also livelihood programs. And the message we're trying to send to the donors is that support for early recovery and livelihood programs is not only critical, but also cost effective. And maybe just to give one example, and it was very clearly illustrated in the video that we saw earlier today. And I think you heard me say that 800,000 people are in tents in northwest Syria. And what we want to try to do is move them into what we call dignified shelter. So this is a more durable structure which provides better protection against the elements, so better protection against the cold in the winter, against the heat and the insects in the summer, but also addresses protection concerns. Women feel more safe in this setup. And, we've tried to, since March 2022, we've managed to move 31,000 families from tents into dignified shelter, but we need to move a lot more. And it's also more cost effective because the tent wears out after about 6 months. So that's, I would say, there's numerous other examples of why and how livelihood support is important. Maybe I just want to say one thing. Immediately after 1 week after the earthquake, I was in Jindiris, where 1,000 people lost their lives during the earthquake, and it was incredible to see the work being done by local communities, women-led organizations. We saw already at that stage debris removal was happening without necessarily external support, from organizations like the White Helmets and others. But I went back a year later and met a shopkeeper whose building had been destroyed by the earthquake. He'd lost family members, and he'd been given a $500 cash grant to enable him to restart his business. And the business was actually flourishing. So I guess the message is, with a relatively modest investment, we can make a real difference to support people and their lives. That's just one example. Thank you.
Okay, thank you, David. I want to ask you here, what the strategy that we can employ to advocate for early recovery and economic initiative with local communities? What the main strategy we can work on?
Yeah, I think as long as we ensure we involve local communities in the project, it's very important. I mean, another project which was really interesting was implemented through local partners, but with the support through UNDP and with the support of the Sierra Cross-Border Humanitarian Fund. And this was a debris rehabilitation. So basically, debris that was gathered from the earthquake was crushed. Women were involved, 600 local people were involved, many of whom were women, in terms of cleaning the debris. And then it was used to rehabilitate roads, which provided better access of farmers to their markets. So I think that's a kind of very interesting type of project. It also had environmental benefits as well, because the debris was actually repurposed and used to rebuild the road rather than being dumped somewhere, causing environmental damage.
Another question about the fund from OCHA and how we can work on this fund and this money to make the empowerment for local organization, for the local communities and other.
Yes, I think OCHA manages this fund called the Sierra Cross-Border Humanitarian Fund on behalf of me as a Deputy Regional Humanitarian Coordinator. I mean, I can say last year it did quite well. It got $140 million, but that was also slightly linked to the earthquake. This year it's received a lot less. And I think the donors that contribute to these funds, and I think some of them are here today, one of the reasons why they contribute is because of the emphasis on support to local organizations. And this has been very much a priority of this fund. As I said, I think certainly more than 70% to 80% of funds distributed have either gone directly to local organizations or to local organizations via international partners. And we know all over the world, in all the countries I've worked in, it's the local people. They understand the context. They understand the culture. They speak the language. They know how to interact with local authorities in order to get the job done. And so it's very important that we continue to give them their support, and particularly these organizations that are led by women. I mean, there's another project that this fund supported, which was mine clearance. Okay, so it's a big problem if we're talking about early recovery and enabling people to go back home. Shepherds can't use the land if it's in a minefield, and people are getting injured, and it can cause life-altering injuries. And Halo Trust was implementing this very interesting project in Idlib, in a frontline area in Ariha, but working very closely. They did it remotely. They were relying entirely on Syrians to implement the project, including women. So it was amazing, actually.
Thank you, David. You give us helpful and hopeful of examples, and this example that's already done in Syria. So thank you very much.